Good afternoon, everyone. This is Dr. Sam from Ashtabula County Medical Center. I'm one of the staff pediatrician in pediatrics department of Ashtabula County Medical Center. So talking about my profession, I see small kids from newborn babies to the adolescent age, up to like 18 or 19 years old. So we go through physicals, if they have any health related issues, talking about like URI infections, respiratory infections, gastrointestinal problems, urinary problems, ADHD, behavioral problems. So we go through all those things. It's been a year since I joined Ashtabula County Medical Center. Just a short introduction of me before this. I'm from Nepal. It's a Himalayan country in Asia, sandwiched between China and India. So two big countries. So it's a small Himalayan countries, landlocked. The most popular thing of our country is Mount Everest. So that's where Everest is. So I did my medical school there in Nepal, and after that, after I finished my medical school, I practiced as like a family practitioner there for like 3 years. And after that, I came to United States for my residency. I did my 3 years pediatric residency in Cleveland Clinic, which I finished last July. It was the same time when I was lucky to have my daughter in my life, so I'm so blessed with that. So July was a big month for me last year, and start August I started working in Ashtabula County Medical Center. It's been a good 1 year. I'm really delighted to be here in Ashtabula, a small city, but lots of nice people, a really good environment to work at. And the summer has been pretty good. So I've been going around Ashtabula. My favorite place is Bridge Street. That's where all the restaurants are. That's where I like to hang out with my pediatric associates. We go to different restaurants. So I hope all you guys are also enjoying the summer. As there's a famous proverb like, with great power comes great responsibility. I have a slight twist to that, saying with great weather in the summer comes opportunity to have a great time, be healthy, go outdoors, camping, sports, all different kind of activities. But with that comes a great responsibility, or something that can affect our health as well. Being outdoors definitely has some health related problems, which we're going to discuss about today. So I've got lots of topics which is basically related to outdoor activities and things that we encounter, especially in pediatric population, but I hope in general it might be familiar to the adult population too. So since there are so many topics here, so how I want to divide this would be, we'll talk about some infections during this summertime, and then some other problems which might not be infection related, and then there will be something about the injuries that might be there during the summertime with all the activities that we are indulged in. So let's start with infections. So common thing that we get during the summertime is swimmer's ear. So we get that a lot in our office. Kids coming in with pain in their ears, itchiness, really tender to touch, some discharge from the ear, and if it's really bad, sometimes there might be problem with hearing problem too, because the ear canal is so swollen that it kind of like blocks the ear canal, so the hearing will be a little bit muffled. So those are the symptoms that we see usually in the kids. If they swim around like lake, also swimming pool as well. So basically, our earwax is a protective thing for us. It is basically like water resistant. Also provides acidic environment so that different bacteria do not get into our ears. Also traps lots of different kind of like irritants or dust particles. So it's a protective thing. But if you're in the lake or the swimming pool for a long time, what that can do is it can basically, because of the lot of moisture, the airwax barrier that it has might be diluted, so that might cause some infection. Or if somebody is like using the Q-tips and they scratch their ears, that's another source of infection. And if you're under the water, that can again there's a high risk of getting the infection. People who wear earbuds most of the time in the day, hearing aid, those can also cause outer ear infection. So swimmer's ear is part of the outer ear infection, but the outer ear infection can be there from many other causes too, just like what I said. So basically, in those cases, when you come to our office, we tend to start you on antibiotic ear drop, which is really important. If it's like really swollen, then in that sometimes we have to use steroid. Pain is a big thing, so we tend to use some Tylenol or ibuprofen to control the pain. The way to prevent it would be to make sure that you use earplugs when you're swimming outside in the swimming pool or the lake. Also, I would advise against using Q-tip and then taking it like really deep to clean your ears. That causes a lot of ear infection too. And also, whenever after swimming, make sure that your ears are dry. That's another way to prevent the ear infection. Okay, all right. So I've got lots of papers here just to make sure that I cover all the topics. So I'll be scrolling through my papers. Let's talk about the allergy. So this is a big topic during this time. Starts from early spring. So seasonal allergies. This is something that we see a lot of times, and yes, it's true. In last couple of decades, definitely allergies in kids and in general has increased. So data-wise, 15% of the young kids, I'm talking about more than 2 to 5 years of age, might have seasonal allergies, and then more than 30% in older kids, they might have seasonal allergies. Rarely does kids less than 2 years old get seasonal allergies, because they have to be in that environment, they have to be repeatedly exposed to those allergens to get those seasonal allergies. So anybody with allergy symptoms, which we're going to talk just now, if those are seen in kids below 2 years of age, it might not be seasonal allergies. It might be some other things which we'll talk about. Some of the allergens, so allergens also depend upon different time period or different weather. So like, let's say during the springtime, it's tree pollens. That's the number one cause of the number one allergen. During the summertime, which we are right now, it's mostly grass pollen and then grass weeds. Those are the cause for the allergies. And then during the late summer or start of fall, it's mostly due to the ragweed. That's what's the number one cause of allergen. Spores, mold spores, those are year round. Especially when it's raining and it's damp, that's when it's in its peak. But it might be there inside the house, so it might be there year round. And there are some indoor allergens which might be there forever, like I'm talking about 12 months in a year. So things like dust mites, cat and dog danders, cockroaches, those kind of stuff can be there year long. And some of the signs and symptoms of allergies would be, kids would be complaining of eye itching. So there might be watering of the eyes, redness of the eyes. So sometimes that might look like pink eye, but it might not be pink eye. It might just be the allergy that's causing that. Other signs would be runny nose, stuffiness. Nasal itchiness is number one symptom in case of allergy, because when we have allergy, we release some of the things, chemicals in our body called histamine, that causes intense itching. So that's how we differentiate. So itching is an integral part of allergy. Sneezing can be there, may not be there, but that is also one of the signs of allergy. And then kids can have like sore throat also. That is also another sign of allergies. One of the things that we usually don't talk about, but it might go unnoticed, is kids, when they have these allergies, their nasal mucosa inside the nose, they might be really swollen. So they might not be breathing through their nose, so they might be breathing through their mouth. And if it happens for a couple of days, that's a different thing. But if this is happening throughout, like months and months, you're talking about a kid sleeping by mouth breathing for months and months, that can cause a lot of sleep-related problems, and that might affect their academics or their behavioral activities. Sometimes they might be misdiagnosed as ADHD also, or it might also affect if they have ADHD symptoms, it might accentuate on the ADHD symptoms. So that is something that that might go unnoticed, or we might not think about. But sleep problem because of the mouth breathing, that's another cause, another symptoms of the allergies. So it's really important to treat allergies. So some of the things that we try is steroid nasal spray. So that's something that we need to try. Usually we recommend, the physicians recommend. It has got very less side effect. I know steroid might have a lot of side effect when taken through mouth. Like I'm talking about all those liquid and pills. Steroid, that has a lot of side effect overall in your body. But when you take it through the nose or the asthma inhaler, those steroid inhalers from nose or asthma, they have very less amount of steroid in it, so it does not have that much of side effect compared to the one that we take it through the mouth. While talking about this, I also want to mention about how to use the nasal spray, especially the steroid nasal spray. The most common side effect, and I see like lots of people use steroid nasal spray, as you know. It's over the counter too. So Flonase nasal spray, something like that. Lots of the common side effect is nose bleeding. But most of the time that nose bleeding is because we're not using it properly. So when you use the nasal spray, it should be directed, the nozzle should direct towards the side of your nose, not towards your nasal septum. So when we spray, if it goes through the nasal septum, it might cause bleeding because we have lots of blood vessels here in the middle. So the proper way to use would be to rotate the nozzle towards the side of your nose and then do the nasal spray. And after that, the child needs to like take a deep breath, like a deep sniff, and that's how you use the nasal spray. I just wanted to talk about this while we're talking about this one. Some of the other things we can try is a nasal saline spray. Those are salt water, so it does not have any side effect to that. You can use it as many times as you need it. That decreases the swelling inside the nose. You can do some saline rinses also, like salt water rinses. Some people like to do that. If there's no side effect to that, you can use that one for the allergies too. And also we can use the allergy medicines like Claritin or Zyrtec, cetirizine. Those are the common medicine that we use. You can use Benadryl too, but Benadryl has got side effect with drowsiness. And we have very good allergy medicine like Claritin and Zyrtec, which does not have that side effect of like drowsiness, and it can be taken just one time a day only, whereas Benadryl has to be taken multiple times a day. So we tend to use Zyrtec or Claritin more compared to Benadryl. Some of the and also with allergies, the other thing is the asthma flare-up. There is a positive correlation with asthma flare-up during these times because they're exposed to all these allergens. The way to prevent that, the thing that you can do to prevent that would be to try to keep the child inside the house. If like let's say somebody has more allergies and flare up of asthma, they've noticed this during early spring. That is the time when you would want to keep your child inside the home, which might not always be possible, but we can definitely try that. Another thing that we can try is, so their bedroom is their fortress, right? So we need to protect them. What we can do is close the window all the time, not even like when it's windy or breezy. Let's just like open the window a little bit. We should not do that because all these pollens might enter inside the child's bedroom where the child is sleeping. So try to keep the windows closed all the time. Other thing is when the kids are playing outside, once they return back to home, we need to make sure that they take off their the clothes that they were wearing while they were playing. It needs to be in a separate room, not in the child's room. We can put it in the laundry to get it washed, but it should not be brought inside the child's room. Also, the child, what we can do is make sure that the child takes shower so that they rinse off all the pollens from their skin and hair. That's what we can do to prevent having them exposed to these allergens. There are these air purifiers, HEPA filters, which is also effective, but it's really costly. So if you want to use it, you can definitely use it, but I'm not sure how much it will be effective when you because it's like a small machine. It might work for like this room, but it might not work for the whole house where you have all the allergens. So the report is like mixed in that one. So that would be some small topics in the allergies, but if you have any questions, just let me know. I can answer you for that one. The other thing in the outdoors, let's talk about the insect bites, because that's something that we get a lot. So that might be mosquito bites, tick bites, another important thing which we'll talk in detail about that one. Bed bugs, also fleas, flies, and then spider bites. That's another thing that we see common during the summertime. So some of the common signs would be some rash. So different insect has different type of like rashes. We usually with the mosquito bites, you tend to get like those red blotches all over the body. That's like a localized reaction. If somebody is like severely allergic, they might have some fever and then some other problems with that. Sometimes these bite marks can, like most of the time, it's really itchy because it's an allergen to your skin, and your immunity will try to attack that thing. That all those saliva from the mosquitoes, your immunity will try to act against that. In a way, the histamine, that chemical that I talked about, will get released, and you'll have that itchiness. So that's most common signs and symptoms. Sometimes it can get infected. That's when we have to start on antibiotic. But usually those are the signs and symptoms. If somebody has like severe allergies to like bee sting, they might go into anaphylaxis from that. Anaphylaxis is severe allergy where you have like your face swollen, lips swollen, breathing problem, all the hives. Kid can have like vomiting, altered consciousness. Those are like severe allergies, and whenever you see that, you need to call 911, because that needs to be that's a life-saving thing that you're doing when you call 911 in these kind of cases, because it can have like really bad result if there is delay in the treatment. Basically, when we have these kind of insect bites, what we recommend is make sure that you wash your hands, wash the area where you have the insect bite with clean soap and water. If it's like really itchy, you can use like calamine lotion. It will give you some relief from itchiness. Also, you can use the Claritin Zyrtec to prevent, as an allergy medicine. But if you're having a lot of redness, pain, or it might be infected too, you need to see your doctor. If it's not infected, sometimes we have to start some steroid ointment. Otherwise, if it's infected, then we basically start kids on antibiotics. The other thing would be tick bites. So let's talk about the ticks, because that is something that we see a lot, especially this year we've been seeing a lot of tick bites, and there has been a lot of reported Lyme disease also. So Lyme disease, one thing that ticks are associated with, but ticks can cause a lot of other problems too. So namely, tick associated rashes, different kind of rash, or there might be some tick associated paralysis of the body that can be seen too. But one thing that is common with tick is Lyme disease. So what is Lyme disease? So Lyme disease is basically these ticks. So there are like 3 different kind of ticks that you can see. Let's talk about that first. So one is black-legged ticks. We also call it like deer tick, because we can find it in the deers. That's why we call it deer tick. The other one is lone star tick, and then the other one is American dog tick. So these are the 3 ticks that you see in United States. The one that is associated with Lyme disease is that black-legged ticks. So basically they have like different forms. The larva form, which is not infective, but they have something called nymph, which is like really small, size of like a tip of the pencil. So that small. Those are your nymphs, we call it nymphs, or the adult ticks, which might be a little bit bigger, like the size of a small eraser. So those are the types of the deer tick or the black-legged tick. The other ones are the lone star tick, which might have like a white spot on the back. The other one is American dog tick, which might have like a whitish color on the back. So these American dog ticks and lone star ticks are not associated with Lyme disease. They might have different other things that they can cause, something like Rocky Mountain spotted fever, but that's not seen here. Or it can cause some rashes like illness. But the one that is associated with Lyme disease is the deer tick. So one of the thing is, so whenever you have a tick bite, so this is something that we usually get asked for, like by the parents, like they go for camping, or the kid is playing outside in the woods, and then they see the tick, and so they would call us back saying that, hey, my kid has a tick, we removed it, but does my kid need antibiotic? So the thing is that there's a Infectious Disease Society of America, IDSA. The recommendation, the criteria that needs to be fulfilled for us to think about, like, hey, there might be a possible Lyme disease here, is first of all the attached tick. That should be a deer tick, right? It should not be those other ticks that I was talking about. So it might be difficult for our parents to decide whether that's a deer tick or some other kind of ticks. So definitely you can try to save that tick in like a small ziplock or something like that, and bring it to the doctor to say, like, to show us, like, is this tick like something that is associated with Lyme disease. If not, you always have cell phone, you can take picture of the tick and then show it to us. You can do that too. But it is really helpful if you can give us some idea about like how the tick looks. So one of the criteria for us to start antibiotic is like the tick needs to be the deer tick. The other is the tick needs to be on your skin, feeding on your blood for like at least 72 hours. It's always tricky to say whether it's 72 hours or not, but usually when the providers, like the healthcare providers, take history from you, we tend to like break down like different events and then try to get an estimate of like when that tick might have been in your body. So the criteria is it needs to be in your skin for like at least 72 hours. The 72 hours mark is because at the end of 72 hours, when they're engorged with blood, that's when they might release that bacteria, which causes Lyme disease to your bloodstream. The other thing is the antibiotic should be given within 72 hours of the prophylaxis should be given within 72 hours of the tick bite. Also, the area also is very important. So where is this Lyme disease found? So basically, in the Atlantic Bay areas. So I'm talking about New York, New Jersey, Delaware, Virginia, spreading to like if you go up Massachusetts, Rhode Island, or Vermont, and then coming to Pennsylvania too, and in Midwest, especially on Minnesota, Wisconsin, Michigan too, and then on the Northern California area. So Ohio is just like between Michigan and then Pennsylvania. So are we also in that 95% times are in those states? So do we fall in that one? No, but definitely we've seen cases, especially in Southeast Ohio. So I have like a really good data about that one. So this was from CDC. Basically, in 2018, when they reported this case of in 2019, CDC published this data that 34,945 cases were reported all over United States, and 67% were confirmed positive. In that, 467 was reported from Ohio, and 83% were confirmed positive. So definitely there is a disease burden in Ohio too. Circling back to our criteria, so we talked about it needs to be deer tick, and it needs to be in your skin for at least 36 hours. The antibiotics should be started within 72 hours of the tick bite. The area also plays a role, and then the person should be able to take that antibiotic. They should not be like allergic to that antibiotic. We just have one antibiotic, doxycycline. That's what we use mostly for Lyme disease, but there are some other antibiotics too. So these tick bites, so how we can prevent that, that's the most important thing. So the way to prevent that would be whenever you're camping outside in the woods, that's where you find it, in the grassy areas. You need to make sure that you wear clothing that has like long sleeves, and that can protect you from getting a tick bite. Also, spraying yourself with these insect repellents. There's this chemical called DEET, DEET. That's the compound that's found in those insect repellents. So we recommend like 10 to 30% concentration of that chemical called DEET. That should be there in that spray. There are some other chemicals too, like permethrin, which you use it in lice, but not that medicine, but you can get it in spray too. That can also prevent from tick bites. So need to make sure that you use that insect repellents at least half an hour or 1 hour before you go to the woods, and then you need to spray it like in 4 to 6 hours again. You should not spray it in kids less than 2 months, because that can cause some neurological problems. But anyone above 2 months, we can definitely start using insect repellents. The other thing is, as when you go to woods and when you return back, you need to make sure that you check all your clothings for like if there's any tick crawling or like hanging around. So you need to check that. And then also you need to make sure that you check your body. So some of the places where these folks like to hide is where we don't check, actually, on the scalp, on the folds like your axillary folds, or the groin area, or the back of the knees too. So those kind of places where we usually don't see. And as I said, these ticks are like so small, you may not be able to find those, like see them like easily, so you need to actively check that. So these are some of the things that we can definitely do to prevent Lyme disease and tick bites. Again, this is a huge topic. If you have any questions, just let me know, I can answer that for you. But again, for Lyme disease, the most common thing that we see is rash. If you see rash, usually it's in the area where the tick bit you. So we see the rash over there. It usually appears within 7 to 14 days. So, but it can last, like it can appear in 3 weeks or 4 weeks also. Every person is different, but usually 7 to 14 days. So you need to call your doctor. In that case, we have to start you on antibiotic for like 2 or 3 weeks. If that goes unnoticed, then later on you can get some other problems like fever, really fatigue, headache, those kind of symptoms, or sometimes like heart problems too. And if it gets really complicated, sometimes you might get some neurological problems. Arthritis is another big problem with Lyme's. So the most common one is the rash, definitely. All right. The other thing, during the summer outdoors, in the skin area would be some skin infection like impetigo, which is basically skin infection from your common bacteria like streptococcus and staphylococcus. So you will see like small bumps with honey crusted kind of like discharge. In that case, we have to start you on antibiotic. Other thing would be boils too, so that should always be consulted with the doctor, because if it's like too deep, we have to like do some incision and like some small surgical process to take all those pus out. If it's really small, sometimes we just use antibiotics and that should take care of that one. All right, so other thing would be fungal infection, which is also common during the outdoor, when you're really active. It might be there in the winter time too, but summertime, since it's like you're outside, because of the moisture, humidity, you might get all those athlete's foot, ringworms, those kind of stuff. So basically, the way to prevent that would be to make sure that whenever you're outside and active, you need to make sure that you basically once you get back, make sure that you wash yourself properly with soap and shampoo, and then change your socks, underwear every day. That is another way to prevent these things. Especially in the kids, when they share the locker room, if they share their stuffs like clothing and all those things, that might spread it to the other kid if somebody had it. That's another way to spread this disease. Other thing is like all these humid places like near to the swimming pool, locker room. Make sure that you have your kids wear slippers or shoes in those kind of places, because when you get in contact with these kind of places, you may get this kind of fungal infection. And the treatment would be, you can find it over the counter ringworm medication. If it does not get better, or if it's red, looks inflamed, in that case you need to see a doctor so that we can give you some other formulation which are really strong. Sometimes we might have to give some steroid on top of that too, like the steroid ointment. Another topic would be sunburn. So that's another thing, right? So when we're outside and we have all these UV lights, so basically you can get sunburn from these UV rays. So you need to make sure that you wear sunglasses to protect your eyes from all these reflected sun rays. These can be reflected from like water, concrete, sand, those kind of things, and then it can affect your eyes. So you need to make sure that you use your shades. When you use your shades, you're protected 80 to 90% of the time, percent of the UV light. So you need to use that one. Another thing is sunscreen. So that's a big thing, right? So there are so many sunscreen in the market. So basically, yes, even though it's cloudy outside, you still need to use sunscreen. everyone I'm talking about needs to use the sunscreen. And then I mean, not like the small babies. I'm talking about like below 6 months. I would not recommend that. You can use like different shades in your stroller and stuff like that to prevent the prevent from sun. But the older kids definitely need to use sunscreen, and the adults too. So some of the things that you need to watch out for the sunscreen is make sure that you get the sunscreen is water resistant. That's one thing that you need to look at in the label. The other thing is SPF. So that's something that we talk about all the time. You don't need like SPF 170 or something like that. SPF above 30, so at 30, 35, 50, those are fine. What SPF means is sun protective factor. So SPF 30 means there's 30% less chance that you'll get, it will protect you 30 times compared to when you don't have this sunscreen on. So that's what it basically means. So 30% of the sunscreen should be fine. You should apply sunscreen 10 to 15 minutes or maybe half an hour before you go outside. So to make it simple, 15 to 30 minutes before you go outside, you need to use sunscreen because it does not work like right away. And then another thing, yes, while we're talking about that, so you might be outdoor in camp, so you'll be using those insect repellents as well as the sunscreen. So how to use together? You should never use it together, because that way what happens is you basically one of the things will not work. So what you can do is apply the sunscreen first of all, and after like half an hour you can apply the insect repellents on top of that. But don't mix it, and don't buy the products that has both insect repellents and then the sunscreen together. That does not work. Another thing for sunscreen would be try to get broad spectrum. That's what it's written in the sunscreen. Try to get one of those. So water resistant and then broad spectrum. That prevents from both. There are two types of UV light, UVA and UVB. So it protects from both of those. Some of the signs of sunburn is redness, some pain, burning sensation on your skin, and in some, if it's really severe, you can get like blistering and swelling too. So in that case, you need to talk to your doctor. Basically, the ways to prevent sunburn, we talked about the wearing sunglasses and sunscreen. The other thing you can try is to make sure that you are not out in the broad daylight when it's like really hot, especially 10 a.m. to 4 p.m. Try to avoid that time to be outside and direct exposure to sun. And also some other thing would be to use different kind of umbrellas, or when you're doing a picnic outside, make sure that you have like shade where you can be under the shade when it's like really hot outside. That can prevent from these sunburns. Also, other thing is tanning. That's another important thing. People like to tan, and that can cause a lot of sunburn. So we recommend against using these tanning lamps, tanning beds, and those kind of things. Okay. All right, and then another thing would be poison ivy. This is also quite common. Basically, if you're exposed to these different plants outside in the woods, you get like all these skin rashes, red, really painful. In that case, you need some steroid medicine, so you need to call your doctor for that. All right, so that were a couple of things. So I want to talk about two important things if we have time. Yes, we have time. So so sports, outdoor activity related injuries. So that's something that I want to talk about. So there can be many injuries that a kid or an adult can get from being outside when you're like really active outside, or when you're playing games. So one thing that I want to talk about, which is quite common, is trampoline. So do you use should you buy a trampoline for your kid, like for a 4th of July gift or something like that? No, we don't recommend against. We recommend against using trampoline, because let me give you some data here. So National Electronic Injury Surveillance System, so we call it NES. So they are the ones who provide all these data. So NES reported that from 2008 to 2017, in individual aged from 1 year, like from 1 year to 17 years old, there was almost 1 million pediatric trampoline related ED visits, out of which 27% was fracture. And in recent years, from 2008 to 2017, there has been 3.8% increase in the incidence of trampoline related pediatric fractures. So you know the burden, like from trampoline we're seeing a lot of injuries. There can be many various kind of injuries, so sprain, bruising, and then fractures, and then some internal injuries and bleeding inside your internal organs, or sometimes the blood vessels might be torn. Those are some of the like really bad injuries that we can get, and then we've seen that with trampoline. So usually when kids they try to do like the flip, that's when we see these kind of injuries. Also the other thing would be let's see, the other thing is when there are multiple kids inside the trampoline. That's another common way how the kids get injured. So when they're like jumping on the trampoline, one kid might fall on top of another kid. That's how they get injured. Now somebody might say like, hey, we have like the side netting. Does that help? No, that is just a false sense of security. They've done a couple of research in that, and some papers say that they've not seen any decrease in this trampoline related injuries with the safety net. And lately, so home trampoline injuries at home has been like constant. It's always been there, and lately there has been lots of trampoline parks, like recreational facilities where they have these trampolines, and that's on the rise. That's where we're seeing lots of like pediatric fractures and all those injuries we just talked about. So we definitely recommend against using the trampoline. Other things would be outdoors. So the kids are playing football. The season is going to start soon. So main thing is concussion. So that's another thing that is quite common in these, but that can happen in other sports too. But definitely, football is one of the top where you get concussion. And then the other sports like soccer, or sometimes in baseball and softball too, we see like concussion. So what is concussion? Concussion is basically, it's a mild traumatic brain injury. So there are many causes of mild traumatic brain injury. Concussion is one of them. So what happens is, because of the collision or because of some force, there is some effect in your brain. Because of that sheer force, there are some chemical changes in your brain which causes you to be altered in your consciousness level. So do you need to lose your consciousness to have concussion? No, but you might be disoriented. You might not remember what just happened. So after couple of minutes, when you pull the player outside from the game, they might not remember what happened over there. So that's what is happening in concussion. So various symptoms like the disorientation part is one thing. The other thing is dizziness, losing their balance, or headache. So usually starts around like 1 to 4 hours, and then when somebody has concussion, it might last for like 7 to 10 days. Okay, but again, every kids are different. So some kids might have the effect from concussion for like months, weeks, and months. So it is so important because we see this so many times when they're playing sports. So it is really important to know what concussion is and to identify that. Also, sometimes there can be brain bleeding that needs to be ruled out. So that needs to be seen in emergency department. When somebody has head injury, you need to see a doctor to rule out, hey, there is no other these danger signs of like brain bleeding or anything like that. And somebody who, if the doctor labels somebody as, okay, this kid had concussion, so now what after that? So after a couple of hours of observation, basically the child gets discharged from the hospital, and we recommend against doing like high intensity exertional activities. Previously it used to be total bed rest for like weeks, but lately the recommendation have changed. So for first few days we would recommend you not to do things that will strain your brain, like the academics especially, and then computers, video games, TVs. So you should not do that. So take rest, and after 1 to 2 days we recommend kids to do some light exercises, like light aerobic exercise, like light walking, not running though, light walking, and then some stationary bike, some kind of, and see like if they can tolerate that or not. If they can, they can continue doing that. And it has been shown that if you do these things, if you start these rehabilitation early, there's a better chance of not having the complication from the concussion. So this is a huge topic that's been going on. Lots of teachings and lots of trainings to the coaches and athletic trainers in the schools have been going on, and in last few years we've seen some progress with that, and schools have also participated with the management of this concussion. So giving the kid time off for a week or two if they have concussion, making sure that they get clearance from a doctor before they start playing again. And then again, when the kids start to play, they go through like a graduated process. So initially light aerobic exercise, and then later on a little bit of like non-contact drills. The intensity will increase based on their tolerance, and after a couple of steps, like 4 steps, then you go to the 5th step where you go actually to the ground, to the game. So it has to go through all these processes, and which the athletic trainer and all those things, people are trained for that one. So yeah, and 2 more things. So let's talk about the heat exhaustion, right? So heat related illness. So you're outside in the hot areas, you can definitely be exposed to all this heat. And we talked about the sunburns, but you can also get heat cramps. If the kid is not drinking enough water, they can lose their consciousness because of that. And there is something called heat exhaustion or heat stroke. Those are 2 different in terms of severity. Heat stroke is like really dangerous. Heat exhaustion is dangerous, but not as dangerous as heat stroke. So basically your body temperature, what happens is your body should regulate the temperature, but when it's really humid outside, hot outside, your body cannot control the body temperature, so your body temperature goes up. So that way what happens is you get dehydrated, and then once you get dehydrated, you lose you're like disoriented, headache, confusion, cramping, and all those things. So whenever somebody has these kind of symptoms, they lose their consciousness while playing, first thing is to get them to shade, and then while you're waiting for the medical assistance, you need to make sure that you try to cool them by using like the water sponges. You can using the cold water, you can do some cold sponging to decrease the body temperature. If the kid is awake, alert, you need to give them sports drink or water, and also Gatorade or those kind of things, for them to get hydrated and then also cool their body. And then again, this needs to be seen in a emergency department, because based on the severity, we may have to do something like rapid cooling and those kind of stuff. And then some kids might need like IV saline and all those kind of stuff. So that's something that is really important. About question about like how much you need to drink. So recommendation is after every hour in kids 9 to around like 12 years of age, at least 5 to 8 ounces of water every hour, and then in older kids at least 1 to 1.5 liter of water every hour when they're like actively playing outside. That's what you need. That's how much you need the water. So that is something that is also really talked about in the schools, and then we make sure that the trainers, coaches know about these things. All right, so with that, I will try to finish up my topics, and if there are any questions, I would like to take some questions.
Okay, so we have a question. So when their child, say they get a concussion, when can they go back to their normal activities?
Yeah, this is something that we tend to get asked a lot about, when to get back to normal. And as I said, so initial few days should be rest, and after a couple of days we advise them to at least do some like normal activities like light like walking, stationary bike, and some kind of like exercises if they tolerate that, stretching exercises, and also like talk to your family, friends, those kind of things. For them to go back to their normal activities, which let's say somebody is an athlete, so the question would be, when can they go back to their when can they start playing again? So that would be a gradual process. As I said, they have to first of all need to make sure that their brain is functioning properly. So the doctor will make sure of, like with all the neuropsychological tests, there are many things that we do in office setting, and once we know that their brain is functioning properly, then we go through these gradual steps of like play. So that's how they get back to their normal activity. So it might take some time. So, and every individual is different, so it depends upon how they cope up with that one.
Okay, we have a question about drinking water. You mentioned children, but what about adults or seniors? How much water should they be drinking?
So definitely, like, I mean, it depends upon like what you're doing, right? So if you're playing sports outside in like really hot environment, definitely you need to drink at least 1 to 1.5 liter of water every hour to keep your to replace the fluid that you lost. So that would be for the adults or older kids. I'm talking about adolescent population, or the adults. But for small kids, like around 8 to 9 to 12 years old, at least 8 ounces of water every hour. They need to get like frequent breaks, frequent rest period, so that they don't get any of these heat exhaustion or heat cramps.
Okay, we have one more question about the sunscreen. What type of sunscreen is better, the spray sunscreen or the lotions?
Yeah, so this is a really good question actually. I would say lotion, because the spray, when you spray it, you might not know, it might be uneven. So let's say this part of the skin got like a lot of sunscreen, this might not get as much as this one, or might not be enough. So when you do the spray, it's been shown that you do not get enough application of the sunscreen all over your body. So but with lotion, it's easy to apply on your skin, and it gets uniformly distributed all over your skin. So definitely lotion is the answer.
Okay.
And also when you use spray, you need to make sure that you don't inhale that. So you need to make sure of that one also.
Okay, well, if anyone has any other questions, they can certainly put it in the comments, and then we will make sure that Dr. Sam gets those and we can get answers for you. Thank you so much,
Yeah.
Dr. Sam, for coming and doing our Lunch and Learn today. And if you'd like to make an appointment, with Dr. Sam, what do they need to do?
So if you need to make an appointment with me for physicals or any health related problems for your child from newborn age to 18 years of age, you need to call our pediatric office. You can find the number in the website 440-997-6980, and that's where you need to call and make an appointment, and Dr. Sam is always there. So I would like to thank Premier Fitness and Wellness team for giving me this opportunity to talk today. It was my pleasure to talk to you all about some of the things that are really common here, common in the summertime. So I just wanted to talk about like mostly the preventative measures, how to prevent all these things. So I before I part, I just want to say something about the when we were talking about the allergies. I thought I would talk about this, but I forgot about this. What if somebody has cat and dog allergy, and then what if a doctor tells the parent you need to get rid of the dog or the cat? What happens? They will get rid of the doctors, not the cat and dog. All right. So, but again, a cat and dog dander, that is not like severe allergy. So we can let them, if they have like severe allergy, we may have to ask that, but usually we don't see like severe allergy with those cat and dog danders. All right. It was pleasure talking to you all, and shoot me with any questions. I would be really happy to help you guys. Thank you.